Listen up, ladies. Young, grown, seasoned, and spicy. When I say every woman, I mean every woman better tune in, because whether you ready or not, menopause is coming for you. Like your auntie at the family reunion. Loud, dramatic, and running the show, you heard? So grab a seat and hang tight. You won't want to miss this.
It has been at the center of a heated debate for decades, but is it a medical condition that needs treatment or a natural transition that's been over-medicalized? In this video, we'll explore what really happens during perimenopause and menopause, the symptoms and the long-term health risks. Let's discover the facts and understand the science behind this important stage of life. Here is a fun fact. Menopause comes from the Greek words menos, meaning month, and pauso, meaning to cease, and refers to the permanent cessation of menstruation.
Hold up! Did you catch that? So you over here wondering why us women gotta go through all this, huh? What really goes down in menopause?
Here's something you probably didn't expect. Women are born with a finite number of primordial follicles, or eggs, which reside in the ovaries. There are about 700,000 at birth. By menarche, this number drops to around 300,000. Over time, the number of eggs declines due to a process called follicular atresia, where eggs naturally degenerate and are reabsorbed by the body. At menopause, only around 1,000 will be left. Did you know that the follicles in your ovaries produce estrogen and progesterone? But as these follicles decrease in number, hormone levels drop.
All right now, pop quiz time. Can you name 3 things that happen when Miss Estrogen packs her bags and leaves? Don't worry, baby. I got the answers waiting for you at the end of this video, so stick around. All right, ladies, let me break it down real quick. God gave us all the eggs we'll ever have straight out the gate. And child, they just start disappearing with time. Drop a comment if that blew your mind.
Here's something important to know. Officially, menopause is when you haven't had a period for 12 months, but the journey there, called perimenopause, can start years earlier. Think of perimenopause as the prelude to menopause. It's when your body starts transitioning, and you might notice some changes. Menopause usually happens between the ages of 45 and 55, but it can be earlier or later.
That's when it all starts going down. But don't just take my word for it. Let's hear from a sister who's been through it, honey.
Okay, can we talk about menopause for a second? Because honestly, it feels like my body is playing some kind of prank on me. One minute, I'm totally fine, and the next, bam, I'm sweating through my clothes like I just ran a marathon. Hot flushes? Oh, they're real. I'll be in the middle of a conversation, and suddenly, it's like someone cranked up the heat to max. My face gets red, my heart races, and I feel like I need to jump into a freezer. And at night, forget sleeping. Night sweats leave me drenched and exhausted.
Hot flushes and night sweats? Believe it or not, doctors still don't know exactly why they happen. But here's what we do know. When your hormone levels drop, it can confuse the part of your brain that controls body temperature. That, along with changes in brain chemicals like serotonin and adrenaline, can trigger those sudden waves of heat. And how bad they feel? That can depend on your genes, stress levels, and even the culture you grew up in.
Then there's the mood swings. One minute, I'm laughing at a cat video, and the next, I'm crying because my toast lands butter side down. It's like my emotions are in shuffle mode, and I never know what's coming next. And let's not even start on brain fog. I walk into a room, stand there, and think, wait, what was I doing? Words disappear mid-sentence, and I swear my memory has just packed up and left. Sleep? Ha! Either I can't fall asleep or I wake up a million times. And let me tell you, running on broken sleep makes everything else worse. And the physical changes? My skin feels drier, my waistline has mysteriously expanded, and my joints ache like I'm twice my age. Oh, and let's not forget the fun of vaginal dryness and bladder issues, because clearly I needed more surprises.
People think menopause always causes depression, but that's not exactly true. If you've never had it before, it probably won't start now. But if you have a history of depression, menopause might stir things up.
Okay now. No sleep, dry skin, weight creeping up, and drama down below too. And if you already had a little depression before, oh baby, now it's front row, center stage, singing backup for the hot flashes. Is there any good news? Somebody pass me a chocolate bar, a cold towel, and a reason not to scream. If you're feeling me right now, drop a girl yes in the comment.
Here's something interesting. In the 1800s, the average life expectancy for a woman was about 50. But today, many women live into their 80s or 90s, meaning they spend a third of their lives post-menopause. That's why the conversation has shifted from just dealing with it to how to manage long-term health risks of estrogen deficiency. But what are they?
So we suffer longer because we live longer? If that's the deal, I want a refund.
Here is another dilemma. Long-term estrogen deficiency can lead to several complications, affecting different systems in the body. Here is one of the most serious effects: osteoporosis. Estrogen plays a crucial role in maintaining bone density, and without it, bones weaken over time. Women can lose up to 20% of their bone mass in the first few years after menopause. But why does this matter? Low estrogen weakens bone, increasing the risk of fractures, especially in the hips, spine, and wrists. Even a minor impact can cause fragility fractures, leading to pain, hospital stays, reduced mobility, and even a shorter lifespan.
And don't even get me started on these bones, honey. One wrong step and snap. Comment below if you know somebody who's had a bone go snap, crackle, pop thanks to Miss Osteoporosis, cause she be out here shady and silent.
As if that wasn't enough, cardiovascular disease risk also rises with estrogen loss. Estrogen helps regulate cholesterol levels and keeps blood vessels flexible. After menopause, LDL or bad cholesterol increases, while HDL or good cholesterol decreases, contributing to plaque buildup in arteries, and arteries become stiffer. This raises the risk of high blood pressure, heart attacks, and strokes.
Wait! Are you serious right now? You trying to tell me after the sweats, the mood swings, and the broken bones, I could still get hit with a heart attack or a stroke? And if you just learned something new, go ahead and tap that like button. Don't be shy now.
But wait, there's more. Cognitive function can also be affected over time. Estrogen supports brain health by promoting communication between nerve cells and reducing inflammation. Some studies suggest that estrogen deficiency may increase the risk of Alzheimer's disease and dementia. Women experiencing estrogen loss may be vulnerable to memory decline, brain fog, and slower processing speeds. Estrogen also plays a key role in maintaining vaginal and bladder health. Long-term estrogen deficiency can lead to Genitourinary Syndrome of Menopause, or GSM, causing vaginal dryness, irritation, and discomfort during intercourse. The tissues of the bladder and urethra also weaken, increasing the risk of urinary tract infections and incontinence. But that's not the whole story. Other long-term concerns are increased risk of type 2 diabetes due to reduced insulin sensitivity, slightly increased risk of colorectal cancer, mental health challenges due to influences on serotonin and dopamine levels, skin and hair changes due to reduced collagen production, joint and muscle pain and stiffness.
Now see, this is just too much. Like, what did we do to deserve all this? Menopause, me and you? Oh, we gonna have some words.
Here is a question for you. Does this mean menopause needs medical treatment? After everything we've uncovered today, it's clear. Menopause can be a lot to take in. The symptoms are real, the long-term risks are significant, and the journey is different for every woman. The key takeaway? Menopause is not an illness. It's a natural biological transition. At the heart of it all is estrogen. Nearly every symptom and long-term effect we see in menopause, from hot flushes to bone loss, is tied to one thing: a drop in estrogen. This hormone plays a major role in so many parts of the body, and when it declines, everything starts to shift. However, for many women, the effects can be challenging enough to impact daily life and long-term health. And when that happens, it's absolutely appropriate to seek support and treatment. Please watch our video, HRT and Menopause, for further clarification.
Want to keep it real and stay in the know about menopause and other health drama? Hit that subscribe, boo! Don't miss a thing.